We'll get started. I'd like to welcome everyone to the Vasculitis Foundation's webinar today. I'm Kathy Olewski, the host for the Vasculitis Foundation's educational webinar series. But I'm also a patient, but I'm living with MPA vasculitis. These webinars are part of the Vasculitis Foundation's commitment to patient education. And in today's webinar, we're having a patient roundtable about urticarial vasculitis with Dr. Galen Foulke joining our patients to give us a clinical perspective. After we finish the webinar today, there'll be a recorded version on the Vasculitis Foundation's YouTube channel, and everyone who is registered will receive an email with a link to it as soon as it becomes available. Just to give you an idea what we're doing today, we have two patients that will answer questions and give us advice about their own personal experience with urticarial vasculitis. And Dr. Foulke is going to add comments and give us a physician's perspective. We would like to make this webinar as interactive as possible. We'd like to get started on our webinar today, but I want to also introduce who's going to be helping you today. First of all, we have Dr. Galen Foulke, who's an associate professor of dermatology and public health sciences at Penn State University. He's the co-director of the Rheumatology Dermatology Clinic at Penn State and has a special interest in vasculitis and related autoimmune diseases. So welcome, Dr. Foulke. We're so happy to have you here with us. And also, we have two patients with us today, and I'm going to let them introduce themselves. I think we'll start with Jessica. If you wouldn't mind, tell us a little bit about yourself.
Yeah, so my name's Jessica. I'm 31. I am from Pennsylvania, and I'm a drug and alcohol therapist, and I'm still in school, so that's fun.
Okay. And next, we would love to have Julia introduce yourself.
Hi, my name is Julia Metro. I've lived with urticarial vasculitis symptom-wise for over 9 years now. Just about 9 years, actually. I was hospitalized 9 years for the first time with urticarial vasculitis. And I've been diagnosed a little under 8 years. And in my day job, I'm a reporter at a publication called Mother Jones.
Okay, well, thank you both for introducing yourself and telling us a little bit about you and for sharing with us today. I'm sure it's going to help everybody a little bit. Before we get started, we have a survey for all of you to take. So I'm going to launch that survey right now and see if I can get it working. There it is. So the first one is, I'll let you do this while I'm talking a little bit. Which of the following symptoms have you experienced with urticarial vasculitis? And you can select all of the ones that apply to you. And then the next one is, how long did it take from the time your symptoms began until you received a diagnosis? Ooh, that's always a good question. And then the third one, of course, is how much does urticarial vasculitis affect your quality of life? So I'm going to give you guys a minute to do that. You should be able to see that now. And I think I will start with Dr. Foulke and see if you have any comments on any of these answers. Is it what you expected? If you can see it.
Yes, it just popped up for me. I would say that this is a pretty good spread. I think the Vasculitis Foundation does such a good job of understanding that vasculitis affects everybody differently. And so it's not uncommon to see that kind of dome-shaped curve of how much it impacts your quality of life. Most people are going to have somewhere in the middle, but it can be extremely severe and life-threatening, as some of our patients have experienced. It can be a minor inconvenience. I came to caring for vasculitis through dermatology and then developing extra rheumatology training. So of course I'm focused on the way it affects the skin, in addition to the way it affects the whole body, but its impact on skin is often very high. I think we sometimes, in the publications and research about urticarial vasculitis, under-discuss the amount of fatigue and malaise, the doctor word for feeling bad, that urticarial vasculitis can cause in a person's day-to-day. So I think it's really good to see that reflected here. Look at how high fatigue appears on this list. I think that's something that doesn't get as much discussion as things like what does the rash look like and what medications are used. So I love interacting with the Vasculitis Foundation because we get to focus on the way that the disease impacts lives as opposed to just thinking about things like what's the biology of it.
Okay, and let's see, Jessica, did you have any comments on any of those answers? Anything surprise you, or you can say no if it was nothing.
I mean, it really didn't surprise me. I feel like, it really just depends on who you are and how it's affected you on what your experience is going to be.
Okay, how about you, Julia?
Yeah, it doesn't surprise me. And I say, out of a personal anecdote, I also got diagnosed with chronic fatigue syndrome around a year and a half ago, which I'm also essentially in conversations with my doctor. It was like my level of fatigue didn't necessarily match my blood level results of. So essentially, I got referred to the chronic fatigue clinic at Stanford. And so now my fatigue, it appears in multiple different ways, is being co-managed by two different specialists. Some is related to my urticarial vasculitis, but some was likely triggered because of my urticarial vasculitis being a bit out of control and me having some severe flares that chronic fatigue syndrome also came into my life. But that was diagnosed like years and years. And I'm also privileged to live in an area where there are chronic fatigue specialists that aren't like super expensive out of pocket doctors, which is also a problem that a lot of people with long COVID are facing right now.
Okay, so thank you so much for your points of view on that. I appreciate that. And Dr. Foulke, I forgot to ask you, I'm supposed to ask if you have any disclosures today.
None that are relevant to this talk. I serve in a scientific advisory capacity for a few companies. I think the only one that's in the last 2 years is a company called Biogen, but they don't have any vasculitis related products. So I just advise them on the science of the diseases they want to treat and help them understand what parts of the immune system should they be approaching.
Okay, thank you for that. And I want to remind everybody, feel free to make any comments you want in the chat box so everyone can see your comments and you can chat back with them. During the questions for our patients, if there's a question that we don't ask that you really want to know the answer to, that's what you put in the Q&A box. And we will get to that as soon as they're done with the roundtable. So thank you for that. And we're going to get started on our roundtable today. The first question today is, what are some of the biggest challenges that you face day to day while living with urticarial vasculitis? And I think for this one, we'll start with you, Jessica, if that's okay.
Yeah, sure. Hands down, I would have to say mental health. I feel like the impact that this entire experience has had on my mental health over the 11 years that I've been dealing with it. It's been pretty intense. It's been a journey. I also would say that it very much so, what did I write down? Yeah, just making sure that you, oh wait, can you repeat the question again? I think I'm looking at the wrong one. Not making
Sure. So the first question for today, it's always helpful to do that anyway, is what are some of the biggest challenges that you face on a day-to-day basis while living with urticarial vasculitis?
Okay, yeah, I did have my wrong sticky note. I was wondering why it didn't make sense. But yeah, I know the other lady, Juliet, she was
Julia?
mentioning, yeah, Julia, she was mentioning chronic fatigue. That's one of the things that definitely impacts me as well. And just feeling very blah all the time, not really having a good way to explain how I feel is how I feel a lot.
Interesting. That's a good answer. Anything else before I move to Julia?
No, I think that's good.
Okay, Julia, how is it for you on a day-to-day basis?
Yeah, for me, fatigue and pain are definitely daily things. Like I mentioned, me and my doctors basically came to a conclusion I was dealing with dual diagnosis, which are definitely feeding into each other when it comes to fatigue and pain. And yeah, how I deal with that on a day-to-day basis, I work from home. That is basically how I deal from it. It makes my fatigue a lot more manageable. However, I do recognize that is a privilege that not everyone has, and especially in an atmosphere where I think some people are company, they're hostile to people working from home, unfortunately. And I don't think anyone should have to go through a treacherous process of getting those accommodations. But however, that is the world in which we live in. So that's I'd say my biggest day-to-day challenge for sure. Dealing with hives. When I went through a medication transition about 2 years ago, I had very bad hives in my hands, which is terrible if your job involves typing all the time. And so that was a previous day-to-day challenge that I think I don't really know how I managed it. I just pushed through it, which I do not recommend. But yeah, definitely pain and fatigue are my day-to-day challenges right now.
Okay, well, thank you for sharing that with us. Dr. Foulke, I'd love to hear your perspective on what they said and anything else you know about your patient and their day-to-day challenges.
Yeah, I think that I'm so glad that you two brought up those major issues. I think earlier in my career, it was really taboo for patients to feel comfortable talking about the impact on their mental health and their emotional well-being. And I think that that's getting easier for people to talk about. I hope in my clinics, it's always been a comfortable and safe place to discuss them. But I think it's just an under talked about part. I mean, something comes along that you have no control over, that you made no choices, that this is a consequence of, and changes the way that your life is lived. I mean, there's a lot of grieving with that. It's no different than if something was stolen from you. And so I'm so glad that that gets talked about a lot. The more we talk about it, the more we can start helping. I think a challenge that patients face can be sometimes too is we can sometimes get the skin under control, but that doesn't mean the vasculitis is gone. Maybe not as much with UV as other types, but that is a big part of UV vasculitis too. We get the skin under control, but the nerves or the kidneys are still quite active, and it can be challenging for doctors that don't have a lot of experience with vasculitis to tease out what's vasculitis, what's just a stomach ache, and what needs to pay a lot of attention to. So it can be very hard to find doctors and care teams, not just doctors, but good care teams that really understand the disease. So Julia mentioned that she lives in an area that's very specialist rich. San Francisco has a lot of specialists. I did my rheumatology work not far from you. But parts of the state or parts of the country where Jessica and I live, specialists are much, much harder to come by and often can involve traveling several hours to get to them. I think another challenge that UV patients face that doesn't get talked about a lot is how hard it can be to get medications covered. We have a lot of good medications that exist for patients, but that doesn't mean that the insurance companies are going to let us give it to the patient. And since UV is so rare and there's no FDA-approved therapies specifically for it, it's a challenge in my day-to-day to help patients get the care they need when companies don't want to pay for things. They often put up barriers like that the medicine we've chosen is not FDA approved, and it's hard for us to say, well, there isn't one. And so I think there's a very long list of challenges that our patients with UV face, but I think our panel members here have described some really, really important and under-discussed ones.
Thank you for that. And I did notice in the chat box that somebody said one of their big day-to-day challenges is remembering to take their medication morning and night, because if they don't, they break out in hives. So you all can put your thoughts in the chat box about how to help remember to take your medications. I know I have some tricks, so it's definitely, I've already seen one good suggestion in there. So thank you for sharing all that with us. And I'm going to move on to the next question for you ladies, and we'll let Julia go first on this one. What treatments or management strategies have you tried, and how have they impacted the symptoms of your or quality of life?
Yeah, I'd say a big one is drugs. Have been very helpful in managing. I did go through a year and a half where I was on and off of prednisone. I would say that was the most challenging time for me, both due to the severity of my symptoms and the psychiatric side effects I dealt with on that drug. However, and I do felt that was necessary just due to the flare-ups I was getting due to being undiagnosed for over a year. That was a challenge. And right now, and I was on dapsone. I had to stop due to mesoglobinemia. I was on a higher dose of colchicine. I had to go lower because of liver issues, which were fortunately very temporary. So I've had not a fun time with some side effects. And now I'm on hydroxychloroquine. My medicine box is literally over there, so I'm looking at the names of everything as I speak. And so I feel very fortunate to have access to drugs. And I'm not, and that's also been a conversation with my doctors because my C-reactive protein isn't as low as it's maybe ideal, but it's not really high either. And so that's something where it's been an interesting conversations where it's been like we are living through an active COVID cases right now, and so that could make it risky to go on certain medications, and my hives are under control. So that's a little bit about my medication journey and other strategies I've tried. It's really working from home.
Okay, thank you for that. Jessica, you want to chime in on that question? What treatments or management strategies have you tried and how have they impacted your symptoms or quality of life?
Yeah, so I have been on a lot of different medications. I'm not even going to try and remember them all. Just a couple is dapsone, which I only remembered because Julie said it. Hydroxychloroquine, mycophenolic acid is what I'm on now. I have kidney involvement as well, like with the vasculitis. So I also take medication to like keep my blood pressure low and stuff like that, so that way we can limit like the blood and protein in my urine. Um, I am finally, after months of some tragic sleepless nights, my insurance company finally did approve like rituximab infusions. So I will be starting those at the end of this month. So I'm pretty excited for that. Well, I say excited loosely because, like, I mean, is it that exciting? But
Right.
my skin has been under control for several years, I would say, like with the hives. The problem for me was I would take a medicine for a while, and then after a while, the dosage would keep going up, and then it would just start being ineffective eventually. Um, but the mycophenolic acid has been working pretty well. It was hard on my stomach, so just dealing with that. And I also have a lot of other health things going on. I have like gastroparesis, so sometimes it's really hard to tell what's coming from where. Um, but yeah, I think I'm on a pretty good treatment regimen right now. I'm excited to see if the rituximab helps get the rest of the vasculitis out of the way, because like Dr. Foulke was saying, you know, even if the skin's under control, there can still be a lot of internal things going on.
Mhm. That famous comment that most vasculitis patients have when people say, "Oh, you look good," you can't see what's inside. So we all have feelings about that comment. Okay, thank you. And the next question is, what would your advice be to someone who's just been diagnosed with UV? Like, what lessons have you learned through your own disease journey with UV that could maybe help someone that's facing the same experience now? Jessica, you want to go ahead with that one?
Sure. Well, my first bit of advice is move to Pennsylvania and find Dr. Foulke. Um, he's been really great. And one of the things that he said to me, and this isn't like word for word, but just the general idea. And to be honest, it kind of changed my life. Don't forget that it's okay to be normal too. I think I get so caught up in the, I have vasculitis thing and trying to live, I don't know, however I need to for that. But it can be easy to forget that sometimes I can wake up with just a stomach ache like a normal person, or just be tired because I didn't sleep well. So that's something that I've had to really cement in my head so that way I don't panic every time, I blink twice, because then I'm like, oh no, what's wrong with my eye? It'll be a big circle of just worrying about a lot of things. And just to try and alleviate some of that stress from yourself, just make sure you have like a good doctor that you can trust and talk to, as well as like family support is really important too.
Those are some really good points. Thank you for saying that. Julia, you want to give us your perspective on that?
Yeah, I'd say one thing that I wish I would have done differently that I didn't do because I was traumatized by the experience of being told my urticarial vasculitis, which I was hospitalized for over a week for, due to psychiatric problems. That I filed a complaint against that hospital. And I was told it was not their fault because I didn't have any organ involvement, which is a wild thing to say about urticarial vasculitis because that is not true for everyone and it's not true for me. Of course, people do have that experience. And so, due to that experience, I was afraid to talk about my mental health. I had severe psychiatric side effects on prednisone, which I was not talking about, which included, and I've written about this, so I'm totally open about this. I was literally in a psych ward after being on 60 milligrams of prednisone. And I was just too afraid because I was like, oh, my vasculitis isn't going to be taken seriously if I talk about my mental health. This has nothing to do with how good the doctors I had since that experience, which was bad. It's just I was so scared because then would they not take my physical health seriously? And I wish I had talked to my doctors from the get-go. Now, like, if I ever have to go on prednisone, I'm going to be straightforward. Like, is there any antipsychotics you can put me on? Because I know that is a thing that happens with people when it's absolutely necessary and they have to go on prednisone. And I wrote an article about this and I've spoken to rheumatologists and that was like something they've outlined with me. And so that was probably the biggest thing that I really wish I had done differently because I think it would have been better for me. And also just getting the mental health support that I needed. What other things? I think that it's also okay to realize you might need more time off. I rushed back. So I took a semester off after I got really sick and I got diagnosed, and I sometimes had like 5 doctor's appointments per week because I had left school in Montreal. It was really cold, which also triggered my vasculitis. And I had gone on vacation to Mexico. I was hospitalized with a C-reactive protein level, I think, of 77. So like it was pretty high, which is very high for nomenclature. I don't know if I'm saying that right. Urticarial vasculitis. That is very high. Good for that type. So like I was pretty sick. They thought I had hypocomplementaric urticarial vasculitis until they looked at my C level thing. I don't have it, but that's how severe my type of urticarial vasculitis got. And I had rushed back to school. I was not in a financial situation where I needed to work, but I think I just had this mindset of like, I need to keep on going. I graduated from undergrad in 2020. I did not need to rush back to school. I think if your body is telling you you need to take a little bit more of a break and you financially can do that, I know that it's not the case for everyone. I think my pain would have been under control better if I had taken a little bit more of that break.
Well, thank you for being so vulnerable with us about that and for raising such important topics, both of you. We appreciate it. Dr. Foulke, would you like to chime in on what they've said?
Yeah, absolutely. First of all, Jess, you're too kind. Thank you. I really appreciate it. Julie, I'm so sorry for everything you've gone through. I've gotten to work with Jessica, as she mentioned, so I get to see firsthand, but it's very courageous of you to share your experience. Thank you for doing that. I think an unfortunate truth of being a young woman with an autoimmune disease is there going to be a lot of skepticism about symptoms. I can't sugarcoat it even in an advanced society like ours. It's puzzling to me why so many doctors accuse young women of coming up with their symptoms or imagining their symptoms or it being a manifestation of psychiatric disease. And I see so many patients in my clinic because I treat autoimmune disease. I see so many patients who have gone through that, and it's heartbreaking to hear that it happened to you. I'm so sorry. I am seeing a comment in the chat right now that a dermatologist strongly recommended against a skin biopsy because they didn't believe it would be urticarial vasculitis. Yeah, I'm sure there's many similar stories in this group. So I'm sorry that that happens. I think Jessica in particular was very kind in her words about me, but the truth is I have very little role in this. I mean, I can help make the diagnosis and I make suggestions for treatment, but I'm not the one out there staring vasculitis down day to day. In fact, when I have learners, I always have learners in my clinic, but I'm always so excited when Jessica comes in, not to teach students about vasculitis. That's very exciting too, but to just let Jessica tell her story because she has faced down some really ugly things and really championed them. And it's super inspiring to me to just be along from the journey and learn from her in the way that she has tackled a disease that has a very big tax on her. So Jessica, I say my advice is to become friends with Jessica Berry and let her mentor you through the experience.
Well, thank you so much for sharing that. And your Mutual Admiration Society is wonderful. We do hear from patients often with a similar message of you have to find the right doctor. And so at the end of the session today, at the end of the webinar, I'm going to go over what can help you with that if you don't have the right one. Many of you have already commented that you do in the chat box, and I'm very happy to hear that. I'm going to ask some questions that are appearing in the question and answer box and also that were pre-submitted. But while I'm doing that, I would love for you all to, in the chat box, I'd like to know if we have any patients here that have any last words of advice to give someone who just got diagnosed, just kind of like we just asked our two roundtable patients, because you never know. We've heard some great things just now, and you never know what somebody else is going to be able to teach us. So if you have something and you want to put in the chat box for everybody, wonderful. But let me start with some of the questions and we'll just kind of see who wants to answer it. And that's how we'll go with this. The first one is, I've read that UV can be part of, oh, this one's for you, Dr. Foulke. I've read that UV can be part of a neoplastic syndrome for cancer. How much of a risk is this, and does it increase with autoantibodies also associated with neoplastic syndromes? Should we be having additional screenings or tests?
Oh, this is a fantastic question. In fact, most of my research is about the relationship between cancer and autoimmunity. That's kind of what I do on a day-to-day basis. Urticarial vasculitis can be associated with cancer. However, that is lower down on the list than other causes. The vast majority of patients with urticarial vasculitis, we're not going to find a cause, or they're dealing with certain viral infections, or they have certain autoimmune diseases already, far and away. We don't see a high enough number of patients with urticarial vasculitis that the disease was caused by cancer for us to be recommending advanced screening for everybody. But that's just when we're looking at everybody. When we're looking at an individual person, that can change. So if we're looking at an individual person who does not have another autoimmune disease, they don't have certain viral infections, they do have certain antibodies associated with cancer, for example, or there are interesting features about the way they're presenting. They've had a cough for a very long time, and maybe that's producing some blood, or they have a strong family history of breast cancer, or they have changes on their exam, that we might find. Then those are patients where we'd be a little bit more aggressive about screening for cancer. I want to assure people that have urticarial vasculitis that cancer-associated urticarial vasculitis is really the minority, and there's usually something else going on when we visit with you that helps us understand that's what's going on there. Far more common than cancer, we're going to find something like systemic lupus, or we're going to find a certain viral infection, or you had an upper respiratory infection 3 to 4 weeks ago. So important question, but I want to give some reassurance that there will be other clues that your doctor can pick up on to find out if advanced cancer screening is helpful for you specifically.
Okay, thank you for sharing that. I know that I have a different form of vasculitis, but that is one of my main questions all the time. What I've been told to keep up with my advanced cancer screening. So I know it's on everybody's mind. I did want to ask, like, the next question is, my doctor, I'm jumping ahead. The majority of my outbreaks are caused by medications. Due to this, I'm allergic to many medications. Is this common to have most of, if not all, outbreaks due to reactions to medications? And either Julia or Jessica, if you have any comments on this, we'll give you a chance also. But Dr. Foulke, do you want to start with that one?
Absolutely. Kathy, I admit I was typing an answer to a great question in the chat.
Okay,
So
I'll tell you again what it is.
please, thank you.
So this person's basically saying most of the outbreaks are caused by medications, and due to this, she's allergic to many medications. Is this common to have most, if not all, outbreaks be due to the reactions to the medications?
I would say that this patient is unique. I'm sorry that you experienced that. That's
Yeah.
a particularly challenging context to find yourself in. Most patients' outbreaks are related to whatever's underlying the vasculitis. So if a patient has lupus at the same time, it's going to be related to a flare in that. We can also see patients' disease get worse around certain infections. So when COVID was especially virulent, holy moly, my clinic was busy because my patients who were getting COVID, whatever autoimmune disease they had was flaring significantly. Stress can flare the disease. If you have an allergic reaction to a medicine while you have urticarial vasculitis, your urticarial vasculitis may flare. Anything that activates your immune system activates both the good things that your immune system does, like fighting germs, but it also activates the bad things that your immune system does, your autoimmunity, urticarial vasculitis in this context. So that can happen, but I would say that is unfortunately quite uncommon. I'm really sorry you're in that position. That's very difficult.
Okay, thanks. I don't know, Julia or Jessica, if you've had any reactions to medications that caused a lot of confusion in your treatment. If you want to comment, if not, it's fine. We'll go on.
Yes,
I mentioned like
Okay, Julia, you first.
I've had side effects of medicine out of range. Like I mentioned, I had methemoglobinemia from dapsone, which is rare, especially rare to have it over 2 years after you start. And I had liver issues with colchicine over 4 years after being on it, but I have not had like a pure allergic reaction.
Okay, and how about you, Jessica?
So mine's not really about an allergic reaction to like the vasculitis medications, but one thing that I went through was I was trying to get my mental health diagnosed, and because I was having so many vasculitis flares before we really knew what it was, I mean, you should have seen my allergic list when I got to Dr. Foulke, and it turns out I wasn't allergic to any of them. So definitely, like if you are trying like new medications, even for something like unrelated during the time that you're getting diagnosed, it can be a slippery slope. So just be patient because it can be a long process.
Well, thank you for sharing that with both of us. And now the next question is actually for Julia and Jessica. Again, someone is asking, how do you manage your career and work? And Julia, I know I heard you say you work from home, but this person says, I find it so hard with my job and with the illness and all the appointments. So do you guys have advice for this person? Julia, you want to go first, or it's okay if you want Jessica to talk?
No, I can definitely go. I'd say like if it's possible to work from home, like, and I do like a very occasionally do stuff in person, but I am very much a work from home person, or like hybrid. I might go in once a month or like go to an event in person. I think that like I just hate that how the world like agreed we could do work from home and then got very hot because there's some jobs where it's like obviously doctors need to see a lot of their patients in person, where it's like not everyone can do pure work from home. But I definitely think trying to get those accommodations can be helpful. I think that one thing at least that I also didn't have to fight for it. Everyone in my company can work from home. I think one thing is that could be helpful in pushing for it is outlining how much more productive you'll be if you're less tired and in pain or whatever your symptoms are. If you can get this accommodation, if you feel like that would be helpful for you.
What a really great point. Jessica, you have anything to add to that?
Maybe not anything helpful because I'm more of like a suffer and talk about it later kind of person. I I was a single mom for a long time, so my job options were very minimal. The job I was working at when I got diagnosed was like outside in the sun and up on ladders and roofs and doing siding, and that quickly became not feasible. So right now, I mean, since I'm still a grad student and working full time, I'm about to start my internship. I don't necessarily listen to my body the way I should sometimes. But I do know that one thing that really helped was finally following through with some like FMLA accommodations. At my job, I do have the option if I'm having like a really bad day where I'm like tired or just not feeling well, I can work from home. That's one thing I'm looking forward to after I am done with school. The field that I'm in should be more of like a at-home based operation. So I feel like being able to kind of finally be able to stop and listen to your body will help when I get there.
That's really good. I don't know, Dr. Falk, I'm sure you hear this stuff all the time, but they've answered it really well. I didn't know if you had anything to add to that.
They are experts.
They
There's
are.
nothing I could add to improve on that answer.
Okay, thank you. The next person asks, my doctor diagnosed me with HUVS because I have lupus. So he said there's probably multi-organ involvement. However, I question if that's true based upon that. Can the statement be made to do the complement levels have to be tested to diagnose HUVS after being diagnosed with UV?
This one sounds like it's directed to me.
Yeah, I think so. Sorry. I
No,
didn't say that, but
that's okay.
I looked at you, but you guys don't know that.
Yeah. No, it's important to take a step back and call out that there's two types of urticarial vasculitis. There's what's called normocomplementemic urticarial vasculitis and hypocomplementemic urticarial vasculitis. And everybody in the chat, this is a spelling test. Spell out all those. I'm just kidding. The names are quite ridiculous.
I can do it. It only took me like 7 years, but I can spell them.
I had to practice in front of the mirror when I was in residency to be able to not trip over those words. These class categorizations refer to a protein in your blood called complement. Complement is a part of your immune system, and its job is to stick to invaders to make it easier for antibodies and white blood cells that kill invaders to connect to them, bind to them, and destroy them effectively. In normal complementemic urticarial vasculitis, your complement levels stay the same. We're really just looking at two members of the complement family. It's a big family of lots of different proteins. We're looking at complement 3 and complement 4 are the most important. I'm simplifying here. In hypocomplementemic urticarial vasculitis, the autoimmune process is so destructive and so vibrant that it is consuming all of your complement. It's using all of it up to get it to participate in the destruction of blood vessel walls. So we see in those patients, C3 and C4 are quite low. When that happens, when we see hypocomplementemic urticarial vasculitis, those patients are much more likely to have lupus. Those patients are much more likely to have kidney disease, and they tend to be younger. So normal complementemic urticarial vasculitis tends to happen a little bit later in life, and hypocomplementemic tends to happen a little bit earlier. So if those complements are low, that tells us this patient has hypocomplementemic urticarial vasculitis, and we are going to be laser focused on watching the kidney health. We understand we're going to see maybe a little bit more likelihood for things like nerves involved or other organs like the lungs. So we watch both types of patients very, very closely. But we have to do things like urine screening a little bit more commonly for our patients with low complement. That complement can get better, can go back up when the disease is under control and come back down during flares. So we can use that complement as kind of a barometer. If we have a patient who says, I'm feeling this, I'm not sure whether it's my vasculitis or whether it's just day-to-day life stuff, that complement level in those patients can be helpful as a barometer. There are plenty of other helpful barometers too. We have lots of data points to help make sure that you are safe from your disease. But this was a well thought out question about complements, and hopefully that's a not too boring example or discussion of it. If you all are ever having trouble sleeping, you can ask me any biology questions. I'll talk forever. It gets so boring, you'll just drift right off to sleep.
I think you did a great job answering that question. I have to be honest, when I was asking it, I wasn't completely sure what I was asking. So now I understand it. So thank you very much. I think if I understood it, others might have. The next question is, can you, this one's for you, Dr. Foulke again. Can vaccinations like flu or COVID cause UV flare-ups?
Such a good and important question. I think the best way to answer this is to step back a couple levels and work toward it. I think the first important level to answer in this question is that anything that stimulates your immune system activates the immune system. It activates all the good things that it does. So you'll be better poised to fight off the cold if you've got a cold. But anytime your immune system is activated, all the bad stuff that it does gets worse too. So you may see a disease flare. So vaccines stimulate your immune system. That's what they're designed to do. They stimulate your immune system to teach your immune system how to fight this invader so that when the real thing comes along, you're equipped to destroy it. The vaccine can flare your disease. What we see, though, is that the disease we're trying to protect you from tends to have a much bigger flare associated with it. So, for example, the flu vaccine can certainly cause a disease flare, but having the flu tends to cause a very big disease flare. And sometimes that disease flare can be so big that, uh-oh, now the kidneys are involved. Oh, there goes the complement. They just dropped low. Things like that. So while vaccines can make the disease worse, when we're talking about broad populations, we think that things like the flu vaccine, the pneumonia vaccine, and the shingles vaccine are really super important for everybody with UV and anybody that's taking immunosuppressants. So in my clinics, you're always going to hear me talking about these. We also respect your autonomy. It's your body. It's your choice. We provide information. We don't twist arms. The data are mixed on the COVID vaccine currently, and there are only certain age groups that are technically eligible, and it's kind of an evolving thing. So I won't pin myself to an answer on that one, but talk to your doctor and make your best decision there. And we get questions about RSV vaccines too. Same situation. Talk to your individual doctor about what's best for you. Again, a long answer to a short question, but a really important question. So I wanted to spend some time on it. I do have some patients whose symptoms started for the first time after they got a vaccine. I definitely have those patients. I strongly suspect those patients would have had the same experience if they got the actual infection as well. And I have way more patients that got their disease from an infection than I do from vaccines. And I think that's everything I want to say.
Okay, thank you. I know those questions are so predominant in our brains, especially this time of year. I have an appointment tomorrow for my vaccines.
If I
So,
could actually just jump in,
yes.
the CDC actually approved the ACIP's recommendation for the COVID vaccine this morning, and is actually open to everyone 6 months and older. There are public health bodies being established in different states, and some are being much more encouraging for the COVID vaccine than the CDC is. However, everyone 6 months and older, it's now much more expanded than it was even a few weeks ago. So everyone 6 months and older should be able to get the COVID vaccine if you want it.
That is some
And that's literally of
excellent,
today.
that is some excellent late breaking news, Julia. Thank you so much.
Yeah, I got this. I'm a journalist. I literally got a press release on it. So I just wanted to add that.
That's perfect.
Patient journalist advocate. Thank you so much, Julia. The next question, I'm sure this is for you, Dr. Falk, because it's another one I don't understand. Do you have experience with prescribing Tacrolimus ointment?
Oh my gosh, do I have experience prescribing tacrolimus ointment? I prescribe the ointment. I prescribe tacrolimus pills. It is tacrolimus or tacrolimus. So Kathy, I'm saying it different than you, but that doesn't mean you said it wrong. It's a Caribbean situation. Depends on, it's like Pennsylvania. The east half of us call it soda. The west half of us call it pop. So different ways to pronounce it depending on where you're from. Yeah, fantastic topical medication that is not a steroid. So it has pretty decent power to control rashes without the side effects of steroids on your skin. So it doesn't thin your skin. It can't cause acne or rosacea. It doesn't cause stretch marks if it's overused. Wonderful medication, but really only for certain applications. If you have a rash on really, really thick skin, it's probably better to pick a steroid to try to approach that rash, unless you have problems with steroids. Tacrolimus is ideally suited for skin that is thin or sensitive, like the face or the armpits or other sensitive skin sites on the body.
Okay, thank you so much. I think you said it correctly because I've never heard of it before.
We were both right. It's my favorite kind of situation.
The next question is, have you seen or do you believe GLP-1s can trigger and cause flare-ups? And does microdosing of GLP-1s help decrease flare symptoms?
I think that one's for Julie and Jessica. No, I'm just kidding.
I am actually on it right now because I gained a lot of weight while on Abilify that I was trying to take for my chronic fatigue syndrome, and I've had no symptoms related to my urticarial vasculitis. So I can answer that.
That's interesting. I wondered how receptive doctors are to prescribing GLP-1s. So
yeah, and I had it because for my chronic fatigue syndrome, and I would say I have a family history of type 2 diabetes and other stuff. So it's like, and I had gained like 20 pounds in like 4 months. And that was like, oh, okay. And I was trying low dose Abilify to try and manage my chronic fatigue. And I haven't had any issues with urticarial vasculitis. And I kind of doubt we're going to see studies on urticarial vasculitis and GLP-1 very quickly, just because it is a rare disease. But just based on personal experience, I haven't, including in injection sites, haven't had any issues with urticarial vasculitis.
Okay, Dr. Foulke, medical answer?
Yeah, I basically agree with Julia. I have a small number of patients with vasculitis that are on GLP-1 inhibitors. I have not seen issues personally, but it is a very small population, so we cannot generalize from my experience. There is active research going on into GLP-1 inhibitors and their ability to calm down inflammation in the body. And people are curious about the degree to which it can have an impact on autoimmunity. I think people are expecting positive responses as we look at this. But again, we are too early and the reports are too small for us to generalize and say anything like it would help or it's safe or anything like that. But my experience has been very similar to Julia. A small number of patients have used it and we have not had major issues. But there is, in fact, there is someone in the chat saying they had fewer flare-ups when they were on one of these agents. So
Interesting. Folks, we are actually getting towards near the end of the hour. So I have 2 more questions and then just some other details to give you before we sign off today. One of them is, Dr. Foulke, can you tell us about any research being done, either possibly or indirectly, that could help UV patients? I'm just, is there anything big out there that we don't know about?
Oh, there's a number of trials going on. There's a wonderful website called clinicaltrials.gov. If you're ever interested, you could go on there and you can enter any disease of interest and look in your area to see if there are trials going on with any physician locally. Yep, there it is in the chat. Thank you, Julie. I appreciate that.
Thank you.
You'll see a number of vasculitis centers doing interesting stuff. Before the meeting, Kathy, Ed, and I were discussing that there are some really exciting new autoimmune therapies coming down the pipeline that will probably be available in the next few years. They have been really transformative in early studies. So I think I wish nobody had urticarial vasculitis, but this is an exciting time to be a patient because I think the number of options available to you all will be increasing very soon.
That is always great to hear. And the last question is for Julia and Jessica. Just your words of advice, anything you want to say to people who are either brand new diagnosed with UV or they're thinking they may have it, but they haven't been diagnosed, or any words of advice for them to, move them correctly down the path?
I'd say the fortunate thing about urticarial vasculitis versus some other conditions, it is a pretty straightforward diagnostic process. So in terms of and please correct me if I'm getting this wrong, it's basically and it depends on the type of vasculitis you have and like different things, but it's looking at blood test results and a skin biopsy for urticarial vasculitis. And so I think if you have a doctor being like, oh, I don't know, and they're not testing your, I don't think you're talking to the right doctor. And I also think that if you are at a place, because I was told that things were like in my head, even I was having some breathing issues and my oxygen was at 91%. I was covered in hives. I couldn't eat. I was vomiting up everything. I was told this was all psychosomatic, essentially. And I just needed the right doctor. I went on vacation to Mexico. My C-reactive protein was 77. And this doctor said, you either have vasculitis or lupus. And I'm like, test me for vasculitis. And it ended up being right. And yeah, I'm not saying that it's a privilege to have vasculitis, but it is just in terms of diagnostic. It's not like some other things that are completely determined functionally, where it's like more up in the air, or you have that or something else. But I definitely think that the process is, once you have the right doctor, it's really good.
Okay. Jessica?
Yeah, kind of going off what she said, with finding the right doctor. I mean, for me, it took like, I think about a year, maybe a little bit longer, of being told nothing was wrong with me. It was all just, we don't know what's going on. And then it was crazy because in like 2 appointments with Dr. Foulke, I had a diagnosis and a medication that was helping. So never stop advocating for yourself is my advice. I don't know, you tend to know your body better than anyone else. So if you feel like something's wrong, then don't stop advocating, no matter how many times even a doctor might tell you that, there's nothing wrong with you. Even to this day, if I go to the hospital for a headache, they just immediately tell me it's my vasculitis. It can be very disheartening. So just definitely keep advocating and speaking up for yourself throughout the whole process is my best advice.
Well, thank you for giving our patients that last word of advice. It's great coming from both of you because it means so much personally to them as well, I'm sure. I'm just going to go over a few last details as we're finishing up today. I wanted to tell you all that it's what many of us learned, maybe the hard way, is that there's a lot of information available at the Vasculitis Foundation website. I mean, under education, you can learn about all the different forms of vasculitis. You can print out things. They have an order print section where you can print out like this great publication that they've worked on so hard. I took mine to my dentist's office recently, just, so that he knew what I was dealing with and so that I felt confident that I was getting the right care as a vasculitis patient. You'll also find a video library with all of the recorded webinars that we've done. And I've been doing them for the last 5 years with the Vasculitis Foundation. There are many, many, many on there. On the homepage, you can find out more about patient support groups. Wow, those are some pretty amazing resources, and I would encourage you to participate in them if you can. There's also upcoming events like live webinars. And what we'd love to just bring your attention to is there are a couple of, first of all, the brand new Find a Doctor database. Well, it's just been updated. It's really great. You can just click on the little tab that says Find a Doctor. And then when you get to the Find a Doctor spot, you can search by your area, or you can search by a particular type of doctor. Somebody was asking about this in the Q&A section, and I said we would go over this with you. This has been a great resource for a lot of patients, and I would encourage you to look here and see if it can help you as well. Also, this is something new on the Vasculitis Foundation's website, or maybe just something that you haven't seen. Here's the page about urticarial vasculitis. You should all be seeing that. You can just go to the front. There's many different ways of getting here, but you can go to the front page. It's fairly easy and say, I'm a person living with vasculitis, and it's urticarial vasculitis, and it takes you to these other pages that give you facts about it, quick statistics if you ever wanted to know how many people ever get diagnosed with it, and symptoms, complications, diagnosis, everything. So this is a great resource for you. Similarly, you can find out about the upcoming in-person events that are happening. There's one this weekend in Philadelphia. So those of you that are in Pennsylvania, I understand, I think you can still register for it. But this is through the Penn Vasculitis Center, and it's the fall 2025 patient education meeting. So there's information right here on the screen. You can find this on the Vasculitis Foundation's website as well. No, that's on October 11th. And then on Saturday, November 1st, the Vasculitis Foundation has one of their regional conferences in Charleston, South Carolina. So any of you that want to come south and see me, I'm going to go from North Carolina to South Carolina to go to this conference. It's a really great way to see what doctors are saying about everything that's up and coming and to meet other patients. And then the last thing that I want to say, of course, is thank you so much to our patient roundtable people, Jessica and Julia today. And thank you to Dr. Foulke for your time that you gave us and your clinical expertise today. And we really, really appreciate all that you all shared with us. And finally, before we leave, I wanted to see all your lovely faces again, but I wanted to tell you that when you leave, there's going to be a survey that pops up. And it's so important to me that you take that survey because it helps guide us on what we do in future webinars. So when you see the continue button, please click continue. And also every person registered for the webinar today will get an email link to this webinar when it is on the YouTube channel in case you want to share it with anybody else. So thank you so much to everybody for being here, and thank you for sharing your patient perspective and your physician perspectives with us, and all of the folks that were watching for chatting with us. Thank you, everybody.